Schizophreniform disorder. Schizophreniform disorder is a type of psychotic illness with symptoms similar to those of schizophrenia, but lasting for less than 6 months. Like schizophrenia, schizophreniform disorder is a type of psychosis in which a person cannot tell what is real from what is imagined. It also affects how people think, act, express emotions, and relate to others. If symptoms last longer than 6 months, doctors consider the person to have schizophrenia rather than schizophreniform disorder. Like schizophrenia, symptoms may include delusions, false beliefs that the person refuses to give up even after they get the facts, hallucinations, seeing, hearing, or feeling things that aren't real, disorganized speech such as not making sense, using nonsense words, and skipping from one topic to another, odd or strange behaviors such as pacing, walking in circles, or writing constantly, lack of energy, poor hygiene and grooming habits, loss of interest or pleasure in life, withdrawal from family, friends, and social activities. Doctors don't know what causes schizophreniform disorder. A mix of factors may be involved, including genetics, a tendency to develop schizophrenia and schizophreniform disorder may pass from parents to their children, brain structure and function. People with schizophrenia and schizophreniform disorder may have a disturbance in brain circuits that manage thinking and perception. Environment. Poor relationships or stressful events may trigger schizophreniform disorder in people who have inherited a tendency to develop the illness. About 1 person in 1,000 develops schizophreniform disorder during their lifetime. The disorder happens equally in men and women, although it often strikes men at a younger age, between ages 18 and 24. In women, it most often happens between ages 24 and 35. If someone has symptoms, a doctor may use various tests, such as brain imaging, like MRI scans, or blood tests to rule out a non-psychiatric medical problem. If the doctor finds no reason for the symptoms, they may refer the person to a psychiatrist or psychologist, mental health professionals who are trained to diagnose and treat mental illnesses. They use specially designed interview and assessment tools to see if someone has a psychotic disorder. For a diagnosis of schizophreniform disorder, the symptoms can only have lasted for less than 6 months. Medication and psychotherapy, a type of counseling, are both used. People with severe symptoms or who are at risk of hurting themselves or others may need to be hospitalized to get their condition under control. People with schizophreniform disorder recover within 6 months. If the symptoms don't improve, the person likely has schizophrenia, which is a lifelong illness. According to the American Psychiatric Association, about 2/3 of people with schizophreniform disorder go on to develop schizophrenia. There is no way to prevent schizophreniform disorder, but early diagnosis and treatment are very important because they can help to limit damage to the person's life, family, and other relationships.